Now to emergency services, and for those who engage in the state's water transportation, the Lagos State government has unveiled a floating clinic that will help address emergency cases on the waterways. The permanent secretary from the Ministry of Health, Dr. Olusegun Ogboye, at an event says the emergency boat will also be used to reach out to children in the riverine areas who will be administered vaccines in the fight against measles.
The 5-cowrie terminal, Falomo, is the take-off point for those using the waterways to get to their various destinations in other parts of Lagos. Several boats are usually moored here, but a floating clinic has been added to the number for emergency services on the waterways, as well as other outreach services within the riverine communities. This initiative from the Lagos State Ministry of Health will also help fast-track the measles vaccination across the state.
It is mainly to deal with emergencies on water, but to also provide outreach services to riverine communities. And one of the first tasks that this boat will be doing is the measles, to join us in the measles campaign that has just commenced in Lagos State, to ensure that we can take the measles vaccine and other vaccines, even the COVID vaccine, to our riverine areas. So it's a strong partnership between LASWA and the Ministry of Health. LASWA has provided the boat, will provide people to man the boat and run the boat, and will also provide diesel for the operations of the boat. The Ministry of Health will provide human resources and consumables for healthcare provision. It's part of a plan that has been initiated by Mr. Governor to ensure that emergency services in Lagos are ramped up and we can respond very, very quickly to emergencies. This is the beginning of the initiative. Yes, there is definitely an intention to expand our ambulance service, our ambulance boats, even our MICs, our mobile intensive care units, our transport ambulances. We're going to scale them all up. But yes, we're starting with one boat, and then we will acquire additional boats to ensure that this service runs well and meets the needs of the people of Lagos State.
Most people have the impression that Lagos is a completely urban city, but for us, we also realize that Lagos has a lot of communities that are along the waterways and are not necessarily connected to the mainstream of Lagos. And Governor Babajide Sanwo-Olu, in recognizing that, also realized that medical services were important to get to those areas. And when it was brought to his attention, it was one of the factors that also played in the acquisition of the boat. So the boat is multifunction. It is going to be an emergency vessel. It is also a tool to reach out to the communities that are far-flung in Lagos.
The State Waterways Authority says it will work closely with the Ministry of Health to achieve seamless operation.
Well, as you know, for us, we've been gradually building this, and we've gradually seen how the safety on the waterways keeps improving year after year, and this is just another initiative to further add to the integrated system of emergency and rescue. Because what we're going to do is have our own core emergency and response boats, along with the jet ski, and along with now soon to be launched control room, which will be launched next month or in about 2 months from now. So this is just going to be one of those initiatives which is going to plug into that emergency and rescue service. Apart from the floating clinic, which will be responding to emergencies, we're going to have the core emergency response team, which is made up of the diver, which is made up of the boat captain, which is made up of the deckhand, and which is, of course, now with the medics as well. So we're going to have the divers on the core rescue boats, which LASWA will provide.
Meanwhile, an official of the State Ambulance Service explains the rescue operation procedure if a mishap should occur.
We have more than a first aid kit. We have sophisticated equipment that we can treat
people, especially maybe if there is a boat crash or accidents, water accidents. Maybe people are trapped. The moment the distress call is initiated, we have our clinic here, we have our staffs that are working on this float clinic. So they will move with the divers to where the incident occurred. The victim will be rescued from the water, and the medical personnel on ground that is well certified in BLS and ACLS will start immediate treatment on this patient while in this floating ambulance. We have a respiratory kit. This is our oxygen that is being fixed here. We have where we put them. We have a resuscitating the apartment here, and then we have all our gadgets that we could work on this patient, even more than the first aid that people will think of. We have a golden hour, which is 10 minutes. But plus or minus, sometimes when there is traffic, that could delay. But while en route to the hospital, the patient will have received optimal care from the ambulance crew. And while on this float clinic too, and on the water, there is no traffic. So as fast as possible, as swift as possible, this patient will be rescued, bring on land, and there will be a waiting ambulance that will take the patient to a referral hospital, which is very close to us. Like now we're in Falomo, we have our General Hospital Lagos that is there. If it happens in Ikorodu, we have Ikorodu General Hospital that the patient can quickly be attended to.
The ambulance boat is made up of 4 sections: the wheelhouse, observation room, doctor's office, and the nurse area. The floating clinic is well equipped with everything necessary to deal with emergencies.